Welcome back. I'm Dr. Kenneth Levine. I'm here with Dr. Donna Schwartz, veterinarian in Coral Springs. Donna, you mentioned dentistry, a boarded dentist. Is that a dentist who does veterinary medicine, or is it a veterinarian who does dentistry?
It's a veterinarian who then subsequently did a residency with it for additional training in dental and oral surgery.
Okay. I understand that in large animals, like in cattle and in horses, having an animal with a bad tooth is a big problem and a very expensive proposition.
Mm-hmm.
Is that right?
Yeah, it is. It's also a problem in the small animals too. I mean, I just had a patient that I took care of today that had a tooth root abscess. So, we needed to do the anesthetic dental, do the x-rays and whatnot, and had discovered that, the affected tooth was a molar where the roots had abscessed. So we needed to extract that tooth, and then subsequently, after doing the x-rays that we needed, we found that there were other affected teeth that had root resorption and furcations and things that we needed to deal with, so not something that we wanted to leave her with.
So you mentioned furcations. I'm a periodontist, and I treat gum and bone disease, periodontal disease, and is that prevalent in animals also?
Yeah, more often than we would think. And and the dogs and cats, dogs and cats in general are okay essentially until they're not. So, there are many cases that come in, and, a lot of times people have a misconception that the patient's not eating because their tooth bothers them or something of the sort. But after seeing this dog, and I tell my clients a lot of times that I have seen really bad mouths, and, the patients are still eating and they're totally fine. So there must be something else going on. And I would say greater than 90% of the time there is, because especially after seeing, my patient's mouth today with, we ended up taking 5 teeth that were affected, and she never missed a meal. Like, she was still eating her hard food, and, they accommodate a lot better than people would.
I have patients like that too.
Yeah.
It's amazing what people live with.
Right.
You practice in a unique environment. Talk a little bit about your practice, your building, your office, your hospital.
Okay, well, I feel like I grew up there because once I graduated from veterinary school, I was at a practice in Indiana for a couple of months before I started my internship where I'm at the hospital I'm at now. So I've been there almost 12 years, and I have the luxury of having specialists available to me and to my clients. We're a 24-hour facility, open 24/7. We take care of emergencies. We have a huge critical care unit. So I do both general practice and emergency critical care. So, it's nice that you kind of feel like you're at a university, because I can walk, not that far and find 2 internists and an oncologist and a cardiologist and neurology and some days ophthalmology. Like, there's everybody there. So that's always nice to be able to do that, because I kind of feel like I'm a little spoiled in some aspects of things, but it's really taught me a lot. I'm learning every day, but the experience I've gained and being able to do what I do, even routine care, just your annual wellness and checking up and making sure things are okay, which is so important.
Do you get referrals from veterinarians who are not part of your group?
Yeah, we have our specialty side that, we have over 400 veterinarians in the area that refer to our hospital for, cases that, they need help on, or things aren't getting better and they second opinion, and, this is something that if they can't, if their facility doesn't have overnight hospitalization or the ability to, care for that animal the way it needs to, then a lot of times they'll send them over to us.
So it's the closest thing to a university setting.
Yes, absolutely.
That you have.
Absolutely.
So if somebody has a problem, it's going to cost them several $1,000s. How can they finance it at your facility?
Well, we have care credit available, which is, I always tell my owners, it's kind of like kitty or puppy credit card that, they apply, can potentially get approved for a certain amount and finance the care that way. And, depending on the plan that they get approved for, they have some plans that are interest-free. But when I see a lot of my patients on wellness visits, just routine things, even if it's just something very simple, I talk to them about insurance, and the insurance has actually gotten better over the years. When I started practicing, almost 12 years ago, the insurance policies really weren't that great. They were reimbursement policies. They had these allowable amounts. They would cap out at a certain whatever for each illness. But now it's much better because they actually have insurances that do major medical So they cover 90% of their major medical expenses.
Terrific. Okay,
Yeah.
we're going to come back in a few minutes. Again, this is Dr. Kenneth Levine with Health Talk, and we'll be back in just a moment. Thank you.
If I could talk to the animals, just imagine it, chatting to a chimp in chimpanzee,